Module Overview. This foundational module introduces you to human biology and basic anatomy as essential scientific underpinnings for professional nursing. It equips you with core knowledge of how the human body is structured and functions, knowledge that is vital for understanding disease processes, patient symptoms, medical procedures, and nursing interventions in the European healthcare environment. Rooted in the European Qualifications Framework, EQF, Level 4/5, this module covers introductory cellular biology, tissue structure, and organ systems, and it aligns with healthcare science standards across the EU. Emphasis is placed on body systems most relevant to early nursing practice: cardiovascular, respiratory, digestive, musculoskeletal, and nervous systems, and their interrelatedness. You also develop terminology comprehension using medical Latin and Greek roots, a linguistic prerequisite for succeeding in clinical language modules later in the course. This module builds biomedical literacy that is directly applicable in health assessments, diagnostics, medication administration, and interpreting physicians' notes. 1. Introduction to human biology. Characteristics of living organisms. Structure of the human cell, organelles, cell membranes, DNA, cytoplasm, cell reproduction, mitosis, meiosis, differentiation and specialization in cells. 2. Tissues and organs. 4 basic tissue types: epithelial, connective, muscular, nervous organ definition and examples, interdependence of tissues and organs for health. 3. Body systems. Overview. Each system is examined in terms of structure, function, common conditions, and nursing relevance. Cardiovascular system, heart anatomy, blood vessels, blood circulation, blood pressure, heart rate. Respiratory system, lungs, alveoli, gas exchange, oxygenation, breathing control. Digestive system, mouth to intestines, nutrient absorption, digestion, liver function. Musculoskeletal system, bones, joints, muscles, movement, postural care. Nervous system, brain, spinal cord, reflexes, sensory input, neural regulation. 4. Anatomical language, anatomical positions, supine, prone, directional terms, anterior, posterior, proximal, distal, planes of the body, sagittal, frontal, transverse. 5. Introduction to pathophysiology. What happens when systems fail? Hypertension, diabetes, asthma, fractures, stroke, linked to nursing tasks, patient observation, medication knowledge, wound healing. Accreditation, standard compliance. This module aligns with EQF Level 4/5, Learning Descriptors, applying knowledge to solve clinical-related problems and make basic judgments in care settings. CEFR Medical Vocabulary Acquisition, A2 to B1, introducing clinical terminology in English, and optionally in German-French. EU Directive 2013/55/EU, Foundational Sciences as a Prerequisite for Nursing Education, WHO, Global Competency Framework for Nurses and Midwives, Core Knowledge Domain 1, Human Structure and Function, Practical Applications and Skills Integration, Labeling anatomical diagrams and body parts, using proper terminology in nursing notes and during vital signs recording, observing patients for signs of systemic failure, e.g., poor oxygenation, abnormal HR, understanding drug distribution via circulatory system, communicating anatomical observations during handovers. Assessment methodology. Multiple choice tests with medical diagrams. Fill in the blank definitions of terms. Practical identification of body systems in simulation labs. Group presentations, linking body systems to disease states. Reflection journal on anatomy's importance in nursing.